During this lesson, we will be discussing medication administration safety. Nurses are entrusted with confidential information and with the lives of their patients during all components of patient care. This includes medication administration. Safe, therapeutic, and effective medication administration is a major responsibility of professional nurses. Administering medication is a continuous process that goes beyond the task of simply just giving medications to a client. The nurse must apply his or her knowledge about the client and the medication. This knowledge is applied by using the medication process of assessing, planning, administering, evaluating, and documenting. Nurses are responsible for safe and prudent decision making in the nursing care of their patients, including medication administration. The steps for assessing and planning include patient data, calculating, storage, labeling, consent, and accuracy. You will assess client and context. Assessment includes present medications, past medications, over-the-counter medications, herbs and homeopathic substances, illegal drug use, medication compliance, age in connection with growth and development, medical diagnosis, laboratory and diagnostic results, experiences with medications, what medication is being prescribed, what is the medication's mechanism of action, what are the medication's benefits or adverse reactions. Be sure to identify allergies or sensitivities. Know your calculations. Is the medication the right dose for the patient? Note the storage requirements for medications. Is the medication being properly stored? Is the medication appropriately labeled? Thoroughly read the medication label. Some medication errors are actually related to labeling and packaging of products that look similar, have similar names, or the medications that are stored close together. Make sure the patient has given consent for the medication and double check the order for accuracy. To reduce the risk of error and adverse effects, a nurse must apply their knowledge about the client and the medication. Prior to administering medications, nurses should assess the patient age and developmental stage, weight, vital signs, and laboratory results. Assess the appropriateness of the prescribed medication for the particular diagnosis and situation. Nurses check for potential effects by assessing allergies, sensitivities, previous adverse reactions, possible interactions with other medications or foods, herbs, or over-the-counter medications that could be contraindicated or decrease absorption. The 6 rights of medication are right patient, right drug, right dose, right route, right time, and right documentation. Following these 6 rights can reduce medication errors. Be sure to follow facility policies when you administer medication in a timely manner. Nurses must meet the standard by ensuring they administer the right drug to the right patient in the right dose by the right route at the right time and provide the right documentation for medication administration safety. A few techniques that should be incorporated into safe medication administration include using aseptic techniques, prepare and administer medication according to the practice setting policies, administer in a timely fashion and monitor the client, read the label 3 times, first time before taking it out of the container, second time while pouring the medication, and third time after placing the medication container back in storage. Some institution policies require a 2-nurse check of the medication dosage. Some of these listed can be anticoagulants, insulin, digitalis, and certain IV medications. These are a few examples. There could be other medications that require a 2-nurse verification, and this decision will be independent per facility. A clear description of safe medication administration is provided by BDS, which is published on a government website. They state, when you give medications, regardless of the type of medication, there are some basic principles that you will always follow. The basic principles that you will always follow are: talk with the individual and explain what you are doing before you give medications. Answer any questions that the individual has. Help the individual be as involved as possible in the process. Provide privacy for the individual. Give medication administration your complete attention. Give medications in a quiet area, free from distractions. Never leave medications unattended, even for a moment. Wash your hands. You must wash your hands before giving medications and then again after you have given medication to each individual. Remember, if you have a question or concern, you should always call for help. Each time that you give a medication, you also need to remember to do the 3 checks. This means that you're going to do a triple check to make sure that the 6 rights are present each time that you give a medication. You must 1. Remove the medication from the locked area and check the prescription label against the medication log to make sure that they match. This is the first check. 2. Before pouring the medication, check the prescription label against the medication order to make sure that they match. This is the second check. 3. After you pour the medication, but before you give it, check the prescription label against the medication log entry again to make sure that they match. This is the third check. When preparing medication, never return a med to a container or transfer a med from one container to another. Medications should not be left at bedside except for lotions, liniments, inhalants, certain eye meds, non-narcotic cough syrups, and nitroglycerin. Most cases, a physician will actually write an order to keep at bedside. Always check with agency policy. BDS also stated on the government website, in order to be sure that you are giving the right medication, you must read the medication label carefully. Remember that some medications have more than one name, a brand name, and at least one generic name. Check the spelling of the medication carefully. If there is any doubt about whether the medication name is correct, stop, call another nurse or the pharmacist before you give the medication. Read the medication order carefully. Make sure that the medication name on the order matches the medication name on the label. Read the medication log carefully. Make sure that the medication name on the label, the medication order, and medication log match before giving the medication. Look at the medication. If there is anything different about the size, shape, or color of the medication, call the pharmacist before you give it. It could be that you have been given a different generic brand of the medication. But sometimes when a medication looks different, it means that you had the wrong medication. The right dose is how much of the medication you are supposed to give the individual at one time. To determine the dose, you need to know the strength of each medication. In the case of the liquid medications, you need to know the strength of the medication in each liquid measure. The dose equals the strength of the medication multiplied by the amount. Some medications must be administered only at very specific times of the day. For other medications, the time of day that you give the medication is less critical. Some examples are: some medications must be given before meals, 1 hour after meals, or at bedtime in order to work best. It is very important for medication to be given at that time of day that is written on the medication order. If no specific time is written on the medication order, ask another nurse or the physician or pharmacist about the best time of day to give the medication. Write this down on the medication log. Medications must be given within a half hour of the time that is listed on the medication log. This means that you have a half hour before the medication is due and a half hour after it is due to administer the medication in order to be on time with medication administration. The half-hour time frame does not apply to PRN medications. For an example, if you have a PRN medication order and a PRN protocol for Tylenol to be given every 4 hours as needed, you cannot give it until 4 hours have actually passed since the last dose. The route means how and where the medication goes into the body. Most medication is taken into the mouth and swallowed, but others enter the body through the skin, rectum, vagina, eyes, ears, nose, and lungs, through a G-tube or by injection. The most common way or route or medications to enter the body is by mouth, also known as PO. Compare the route on the prescription label, the medication order, and the medication log. If they do not match, or if there is any doubt about whether you're given the medication by the right route, ask questions. This is why we do the triple check. Sometimes mistakes happen when you are giving several medications by different routes at the same scheduled time. For example, you may be giving an eye drop and an ear drop to the same individual at the same time. If you become distracted, you could accidentally put the eardrops in the individual's eyes. This would be a very serious mistake. Avoid this type of mistake by giving the eye drops first and then put away the eye drops. After you have put the eye drops away, then give the eardrops and immediately put them away. Patients have a right to know the name and the action of a medication. Therefore, it is important to know the actions, classification of medications, and the nursing measures to be done before giving medications. This is the nurse's responsibility to know more than just the memorization of the names of medications, their use, and associated interventions. It requires a sound comprehension and application of medication knowledge to a variety of clinical settings. This will ensure the provision of safe and effective medication administration. To ensure you have the right patient, carefully identify the patient by 3 identifiers. Ask name and date of birth and compare it to the MAR. Then verify the armband with the MAR. The patient should never be left alone until you observe the patient swallowing all medications. The nurse who prepares a given medication should administer the medication. Never administer a medication you did not prepare. BDS on the government website also provided information stating, in order to make sure that you are about to administer medications to the right individual, you have to know the individual. Even when you know the individual well, mistakes can happen. Sometimes when medications are being administered to more than one individual in a setting, or if you prepare medications for more than one individual at a time, you can be distracted and give the medications to the wrong individual. You can avoid a serious mistake if you prepare medication for one individual at a time. Give the medication to the individual as soon as you prepare it. Do not talk to others and ask them not to talk to you when you are giving medication. Do not stop to do something else in the middle of giving medications. Pay close attention at all times when you are giving medications. You must also compare the individual's name on the prescription label, the medication order, and the medication log. Make sure that they match. If they do not match, or if there is any doubt about whether you are giving the medication to the right individual, ask questions. If you make a mistake, follow your agency's policy for reporting medication errors. You may need to call the individual's physician, the Poison Control Center, and/or take the individual to the emergency room for evaluation. This is why we do the triple check. Evaluate and document the patient's response to the medication. This includes therapeutic effects, side effects, unexpected responses, or possible toxic effects. Do we document during or after medication? This is a trick question. We document medication administration at the time that the medication is administered. Ongoing documentation during medication therapy is in congruence with documenting the patient's response to the medication. Be the patient's advocate. If a patient is continuously asking for a PRN medication on a routine basis, advocate for that patient. Get the medication scheduled as a routine medication. The proper way to verify a physician's order. It is best to have the physician write the order in the chart. If you are unable to read the written order, call the physician for clarification. The order should contain patient's name, date, name of medication, dose, which includes size, frequency, and number of doses, route, and physician's name. When taking a verbal order, repeat the order to the physician for clarification. Write the order as you are receiving the order, then reread the order back to the physician for verification. One element that can cause medication errors are the misuse of abbreviations. Be aware of using abbreviations. Listed here are a few dangerous abbreviations. Please review this list. This concludes this lesson. If you have any questions related to the content of this lesson, please contact the instructor.